We got 2 days together, and I don't know what in the hell I'm going to say or how the hell we're going to get anywhere. But I'm going to be talking about me. And the nice part about being an old man is you can get away with more of that. And I hope, sometimes I really think, that I do more of it. I'm more aware of myself than I was, I don't know, 25 years ago. Sometimes I wake up at 4 o'clock in the morning in my panic about meeting a new gang and to have something new happen to me or think of something new to present it. And I did this morning, but I can't remember what it was. But first I want to talk about us. And really I'm talking about me, but I was thinking this morning, if you put that shoe on that I'm wearing, be careful because it can get awful damn tight. And you get bunions and fallen arches and athlete's foot and all sorts of crazy stuff. But I want to stick you with it because it helps me to get over some of my pain, to use you as my therapist and try to relive some of my pain and thus cut it back. In a 2-day interview, you know, it's pretty unusual to have a 2-day interview. So I feel one of my joys in this kind of racket is the psychotherapy I get from making you into my therapist, wandering around in my insides. And I guess the most important thing is how sick we are. I think I was 13 or 14, I hope I wasn't any older than that, when it was very clear to me that I was going to be a missionary, a religious missionary, and convert all the Chinese to Christ. God, how sick can you be? But, of course, I've gotten over that. I'm not doing that now. You don't look like Chinese. But I think anybody who decides to earn a living by trying to help people who are crazy, when we're all just as crazy or crazier than they are, and we haven't been able to do anything about ourselves, you know, it's really pretty sick. I'm going to be the best supermom. And one of the best examples of this is a weird thing. You know, I assume all of you guys, I think I've partly gotten over it, take every case that comes as though it was the first time they'd ever been to psychotherapy. We don't even record the fact that they've had 7 previous therapists and they just got mad at the last one when negative transference didn't hold close enough, so they left and came to you. It's like 8 marriages. Imagine going to bed with 7 other women at the same time. It's a big bed. But we do that, you know. I was one of those psychologist types, you know how they are. Wrote a book about psychotherapy. I've forgotten the title. But he had 4 jobs in his first 4 years after the PhD, and he picked up a case from each one of the jobs. And the one I remember so clearly is a woman who came in, Peck is his name, that's right. And a woman came in and said, he asked her about her previous therapist, and she listed them. She'd had, I think, 20. So he got name and telephone number of all of them, and he called them all, and for the next 18 weeks, well, 2 of them wouldn't come. They're probably analysts. One of them came to their interview, he and his patient, to explain about their failure. So she had 18 hours of feedback. Can you imagine? What an experience. And then you said, well, I don't know what I can do, you know. You haven't made it with the previous 18. I don't think you and I ought to try. That's the important thing.
Nobody can get a grip on things like you. So beautiful, things like you abound on account of